Welcome back to Empower Indie Podcast. This podcast creates space for honest conversations about health, well-being, and community resources to help people in southwestern North Dakota live healthy, full lives. The Empower Indie Podcast is produced by Women Empowering Women, a nonprofit organization dedicated to connecting, supporting, and educating women to help them become the best versions of themselves. To become a member or learn more, visit wewnetwork.org.
Today, we're talking about something that sits right at the intersection of access, timing, and health outcomes, and that's after hours and weekend care. In healthcare, a lot of conversations focus on treatment, but just as important is when people are actually able to get that care. Because for many families, symptoms don't follow a 9 to 5 schedule, and decisions often come down to what's available in that moment. We're going to dig into what providers are seeing on the ground, the most common situations that show up outside of regular clinic hours, and what happens when care gets delayed because it's evenings or the weekend. Today, we have Crystal from Advanced Care Clinic. Let's get started.
Okay, I'm so excited to be in this seat.
Yeah, thank you for coming and thank
Yeah.
you for giving me the host abilities. I
Yes.
hopefully don't screw that up too much. But tell us a little bit about your new clinic and what patterns you're seeing in patient care that made after hours and weekend access a real health need in this community.
Okay, so in primary care, a lot of times I notice that my patients are really struggling with work schedules, with kids' schedules, with having to use their PTO to have
Mhm.
doctor's appointments.
Ugh,
Like just to get basic care,
yeah,
they have to take their time off that could be spent with their family for
yes.
vacation to get care.
That's too
Or they spend hours and hours in a walk-in clinic or
much.
an ER.
And then just being exposed to
Yeah,
everything that's there.
right, so it's a vicious cycle,
Yeah.
and they don't a lot and then a lot of men or, husbands are not getting care at all because they
Mhm.
work 12-hour shifts or even, nurses.
Yeah.
Like, they work 12-hour shifts. If it's not on their day off that they can do, again, they have to take their day off and they have to go, where it's not convenient for family life or work life.
Yeah,
It just doesn't work.
and with just everything kind of changing in this modern day too, like it's not just simple 9 to 5 jobs
Right.
anymore.
Yeah.
Yeah. What are the most common health situations that tend to show up outside of traditional clinic hours?
Ear infections?
Mm-hmm.
Are probably the biggest one for
Yeah.
like kids,
Yeah.
for family
Hmm.
practice is those really simple illnesses that are things that they catch at school that they have a fever, they're not getting better, they're fussy, the parents aren't getting to sleep at night, things like that. The things that also just kind of get dismissed or ignored for a long time are diabetes because they're justifying the symptoms. It's a slow progression. It's not like you wake up one day and you just don't feel good. It's so slow that you don't realize it's happening and you keep putting off the primary care, you keep putting off the preventative labs. And then by the time it's a problem, it's a real problem.
Right, right. And that's a lot of workup
Yeah.
too. So it's not something that you can just hop on over and get most of
No.
the time, especially when you have
Right.
a pretty demanding job.
Yeah.
Well, that kind of leads into the next question then. What happens clinically when people delay care because it's the evening or the weekend?
Right. So it ends up causing a bigger mess
Mhm.
because the small problem that maybe we would have caught their blood sugar, at a lower rate becomes a huge problem. Maybe their blood pressure was a little bit lower if they had gotten care earlier,
Yeah.
but because they're not able to get access to care, then it cascades and it becomes a huge problem. And then it's huge workups and it's specialty visits and it's a lot of time from work.
Yeah. Yeah, and a lot more money
Right.
and yeah, resources for sure. What are the biggest reasons people avoid seeking care after hours, even when they probably should?
I think probably cost.
Yeah.
Cost is a big one. So having to go to an urgent care or an emergency room costs a lot more than going to a primary care provider. So to be able to have a primary care provider that's providing some of those after hours times that you can be in network with, that it's not going to be those emergent cases.
Yeah.
You're still getting the same day care or you're still getting that preventative care, but it's not after hours and it's not at a higher level of care.
Yeah. Well, and it's with somebody that they know
Right.
too,
Yeah.
and that's the point of like being a private practice primary
Right.
care is that they have more of that accessibility and they don't have to
Right.
go through 8 different people to reach you.
Yeah.
And I do find that people like that in all access of
Yeah.
their care because it
Mhm.
has become so streamlined,
Right.
the medical care. So, what do you mostly see patients try first before they decide to come in?
Google.
Yeah. Yes.
Usually
Doctor
Google.
Google.
Doctor Google.
Mhm.
Chat now.
Uh-huh.
Chat's a big one.
Yes. Yeah.
So they usually find every option they can that's over the counter, that is home remedies,
Mhm.
and it just a lot of times could be taken care of quickly.
Yeah. Well, which is also a good thing though, because I feel like in the modern age now, we don't pass those things down through
Right.
generations anymore.
Yeah.
So we got to find that access somewhere, and it
Yeah.
is a good thing to try those things before they come in,
Yeah.
right?
And I think it's a cultural thing too, because they're
Yeah.
trying all of those things and they're going to Google and they're going to chat because the approach that they get when they go in and they haven't tried everything is that they shouldn't be there.
Yeah, that's very true. Yeah, and that hinders access as well,
Yeah.
because then that makes them
Right. It
scared.
makes them scared
Yeah.
and ashamed and embarrassed to come back.
Yeah. How do you help patients decide then whether something is urgent, can wait, or needs emergency care?
I think that emergency care is like life threatening. Like you feel, extreme pain, you're dizzy,
Mhm.
you have chest pain, like you have stroke symptoms. Those things are emergency care.
Mhm.
You have a cut or a broken bone or something like that is emergent. Um, if if you're feeling like you're going to pass out, if you're peeing or having, you know, bloody stools,
Yeah.
any of that, like
Mhm.
those are emergencies. Severe abdominal pain, any kind of severe pain, that's an emergency. So I think that just knowing what emergent is, and also if it's just a knowledge deficit, they just don't really understand, I don't ever tell someone they shouldn't come.
Yeah. Right. And
They literally can come
anxiety.
for any single thing
Mhm.
and it's okay.
Yeah, absolutely. And like,
So,
and a lot of those symptoms all mimic each other
right.
too. And so how do you
Yeah.
know,
And you don't know until you
Yeah,
get that second opinion
right.
and you work with someone.
And you work it up.
Yeah.
Absolutely. What are the most common symptoms or scenarios that people underestimate and wait too long
I
on?
think it's that the blood pressure, diabetes,
Mhm.
that kind of stuff. Sometimes the abdominal pain,
I
you
was
know,
just gonna say that.
abdominal pain can be a cancerous mass or something that they've ignored for a really long
Mhm.
time.
Or they wait on that appendicitis and
Right.
then it ruptures and
Yes.
then it's definitely an
Yeah.
emergency and a long hospital stay.
Hmm.
What are the biggest misconceptions people have about what requires immediate care?
I think the shame that comes with it
Mm,
of being worried that they're going to be
mhm.
judged or that,
Yeah,
that they shouldn't be there.
yeah. Like they tried everything possible
Right.
before they got like
Yeah.
sometimes you just need to go.
Yeah.
Yeah. What does delayed care tend to change in terms of treatment, recovery time, and complications?
Definitely complicates everything because those things that could have been prevented or taken care of really early on
Yeah,
become a lot bigger of a problem.
right.
And then it takes a long time to reverse it if it's even reversible and it
Yeah.
hasn't caused, in organ damage.
Yeah, and I think it just really goes back to the fact that like people, we need to feel comfortable with who
Right.
is giving us care.
Yes.
And we need to know that we're a priority and that
Yes.
it is okay to ask those
Hmm.
questions. Otherwise, they do get swept under the rug
Right.
and then what do we do?
Yeah.
Yeah.
And something that, as we're opening this clinic is really tried to think, okay, what do I need from healthcare?
Yeah.
You know?
Right.
So I need to be able to know that I can go when I need to go when it is convenient for my family.
Mhm.
So after hours care, weekend care, that helps.
Yeah.
That
Yeah.
helps that need. I need to know, or in the past needed to know, that even though I was on Medicaid or low income, that I was going to be treated kindly.
Mhm.
That
Mhm.
it didn't matter what my payment method
Mhm.
was,
Mhm.
that I was going to get the best care and I was going to be treated appropriately, you know?
Absolutely. Absolutely. Like human kindness. That's
Yes.
all it is. Yes.
Yeah.
Okay. Well, can you share some examples of conditions that become more serious simply because they were not addressed soon enough?
Yeah, so I think the diabetes, so the diabetes affects all of the microvascular, parts of the body. So the eyes have tiny vessels, the kidneys have tiny vessels, the peripheral veins do. So like the feet, the hands. So the nerves, all of those areas get damaged first, and a lot of times it's irreversible. Like you can't reverse it.
Right.
So, that's how they end up with those, vision
Mhm.
changes and vision loss and kidney failure, and so having that early prevention and intervention is
Mhm.
super
Yeah,
important.
absolutely. And I mean, obviously that helps with timely access to
Right.
prevent them from going to emergency rooms
Yeah.
and those kinds of things,
Hmm.
systems. What gaps in the current healthcare system does after hours access help address?
So one of the big ones that I think is those workers that have limited schedules,
Mhm.
being able to access primary care on the weekend is game changer for a
Mhm.
lot of people that
Mhm.
normally don't get care.
Right.
They have insurance, they just don't use it
Mhm.
because they can't.
Right.
So,
I think we see that in the emergency care,
right.
where people are just using that as a primary
Yeah.
care, a refill for some blood pressure medications or
Right.
something simple.
Yeah.
But like you said, if you ignore it, it can lead to some life-threatening
Right.
issues.
Yeah, so I kind of explain it with like especially our oil workers in this area, like they would never get in their rig without doing a pre-trip
Mm.
inspection. Like
Mhm.
they would never not
I
check.
love that you know that.
Yeah. They would never not walk around the vehicle and make sure everything looks good.
Yeah.
So, and then they know that that's preventing issues later,
Just relating
So,
to them like that is
right.
even so important.
I also kind of relate it to them as like a athletic performance evaluation, not a physical,
Yes, I
because
like that.
they're athletes. They're
Yeah.
doing athletic things. So when I call it that, they're like, "You're right. I am an athlete.
Elite
Yeah,
athlete.
I'm an elite athlete,
Yes. I love that so
and I need
much.
to stretch too."
Yeah, right. So, I mean, it sounds like the point and the purpose of the advanced care clinic is really just to give more access.
Right.
Yeah, and down at the level that the patient needs it.
Yeah.
Yeah.
So things that I have experienced in the past, like not having access when I needed it, working 12-hour shifts and not being able
Mhm.
to get my kids in when they were sick for a
Mhm.
quick visit, or having to go on days off and spend my whole day off doing visits,
Yeah.
rather than PTO,
Yeah.
using all my
Yeah.
PTO on a day I should have been at work
Right. Right. Absolutely.
for
So,
something
tell
quick.
us kind of what hours you're gonna have, and what that's gonna look like.
Yeah, so we're doing Sunday through Saturday, and weekends it'll be 11 to 8, and then Monday through Friday it'll be until 8 o'clock at night. So,
Awesome. That's
yeah.
wonderful. Such an important conversation around something that
Yeah.
really impacts both access to care and patient outcomes. When care is available at the right time, it can make a real difference in comfort, recovery, and even preventing more serious complications down the line. Thank you so much for sharing with us today, Crystal. Thanks for
Thank
letting
you.
me take
It
over.
was fun
And
being in
then,
the seat.
yeah, until next time, stay informed, stay empowered, and we will see you on the next Empower ND podcast.